Understanding the role of thiazole thiamine component in alcohol consumers. Introduction to thiazole and its importance. Thiazole is a crucial structural component of thiamine vitamin B1. This nitrogen and sulfur containing heterocyclic ring is essential for biological activity. It allows thiamine to act as a coenzyme in key metabolic pathways, particularly in glucose metabolism and nerve function. In patients who consume alcohol regularly, thiamine deficiency is a significant concern. Chronic alcohol use disrupts both thiamine absorption and transportation, leading to severe metabolic and neurological complications. How alcohol affects thiamine absorption and transport. Chronic alcohol consumption impairs thiamine status through several mechanisms. 1. Reduced gastrointestinal absorption. Alcohol damages the intestinal mucosa, reducing the active transport of thiamine across the intestinal lining. Alcohol also inhibits thiamine transporters THTR1 and THTR-2, which are responsible for absorbing thiamine in the small intestine. 2. Impaired hepatic conversion. Alcohol interferes with liver function, reducing the conversion of thiamine into its active form thiamine pyrophosphate (TPP). This reduces the availability of thiamine for critical enzymatic reactions. 3. Increased urinary excretion. Alcohol acts as a diuretic, increasing the excretion of water-soluble vitamins like thiamine through the kidneys. Chronic alcohol consumption further depletes intracellular thiamine stores over time. 4. Disrupted transport across the blood-brain barrier (BBB). Alcohol impairs the active transport of thiamine into the central nervous system. This deficiency leads to neurological conditions like Wernicke's encephalopathy and Korsakoff syndrome. Pathophysiological impact of thiamine deficiency in alcohol consumers. When alcohol-induced thiamine deficiency occurs, the following physiological dysfunctions are observed. 1. Energy metabolism disruption. Thiamine is vital for pyruvate dehydrogenase and alpha-ketoglutarate dehydrogenase, which convert glucose into energy ATP. Without thiamine, pyruvate accumulates and is converted to lactic acid, causing lactic acidosis. 2. Neurological damage. Thiamine deficiency leads to myelin sheath degradation, impairing nerve conduction. This results in peripheral neuropathy, ataxia, and cognitive dysfunction. 3. Cardiovascular effects. Severe thiamine deficiency can cause wet beriberi, leading to cardiomyopathy, congestive heart failure, and edema. 4. Wernicke-Korsakoff syndrome. Wernicke's encephalopathy presents as acute confusion, ocular disturbances, and ataxia. If untreated, it progresses to Korsakoff syndrome, characterized by irreversible memory loss and confabulation. Role of Thiozole 100 thiamine in alcohol-induced deficiency. Thiozole 100 by Azmed Healthcare provides 100 mg of thiamine, which is crucial for reversing the effects of alcohol-induced thiamine deficiency. 1. Restoring cellular energy production. Thiozole replenishes thiamine levels, reactivating key enzymes in the Krebs cycle and restoring normal glucose metabolism. 2. Protecting neurological integrity. Early administration of intravenous thiamine prevents permanent damage to the brain and nerves. This is particularly critical in preventing or reversing Wernicke's encephalopathy. 3. Correcting acid-base imbalance. Thiamine supplementation reduces lactic acidosis by enabling the metabolism of pyruvate into acetyl-CoA. 4. Cardiovascular support. Thiozole helps reverse the cardiovascular complications of wet beriberi by improving myocardial energy generation. Clinical recommendations for alcohol consumers. Medical professionals should prioritize early intervention with Thiozole 100 in patients with a history of alcohol consumption. 1. Prophylaxis. In high-risk alcohol consumers, a daily oral dose of 100 mg of Thiozole 100 is recommended. 2. Acute deficiency e.g., Wernicke's encephalopathy. Intravenous thiamine, 100 to 500 mg over 30 minutes 3 times daily for 3 to 5 days, followed by 100 mg orally for maintenance. 3. Chronic alcohol use. Long-term supplementation with Thiozole 100 mg per day is advised to maintain thiamine stores and prevent neurodegenerative complications. Conclusion: the importance of Thiozole 100 in alcohol-related thiamine deficiency. Thiozole 100 is a critical intervention in managing and preventing thiamine deficiency, especially in patients consuming alcohol. It plays a key role in restoring metabolic pathways disrupted by alcohol, preventing irreversible neurological damage, improving cardiovascular outcomes. Early and appropriate administration of Thiozole 100 ensures optimal patient outcomes and prevents life-threatening complications associated with alcohol-induced thiamine deficiency. Thank you for your dedication to patient care and for choosing Thiozole 100, your trusted partner in metabolic health.